Namaskar and welcome to our special series on Eye Matters Daily. Did you know that glaucoma is one of the leading causes of irreversible blindness? It is estimated to affect around millions of people in our country. And what's more concerning is that most people don't even realize they have it until significant vision loss has occurred. Today, we'll be talking to an expert to understand what glaucoma really is and why early detection is so crucial, and how you and your loved ones can take simple steps to protect your vision. So let's get started and shed some light on this silent thief of sight. Doctor, recently I've been hearing a lot about glaucoma and how it silently leads to blindness. Can you help us understand what glaucoma really is and what are the most common risk factors leading to glaucoma?
Okay. Yeah. Hi. I'm Dr. Lavanya. I'm from Sri Narayana Super Speciality Eye Care Hospital, Hoskote. I'm a phaco surgeon here and as well as a general ophthalmologist. Yeah, today it's a good question to know about the glaucoma. Glaucoma is like a silent disease, and most of the people are not aware of the glaucoma. What is glaucoma and all? It is a pressure-related issue, and the way we have the blood pressure inside the body, the similar way we have eye pressure also to maintain the nutrition and the size of the globe and all. So sometimes some people have the higher eye pressures and some people have the normal pressures and some people have the open angles, means it's a space will be inside the eye will be like more, and some people will have the narrow space. And depending upon these things, factors, and they have the types of glaucoma. Glaucoma is a kind of like silent disease, and once it is like it started in particular person's eyes, and so slowly the nerve will be like optic nerve, which is coming from the brain. It is the second nerve. As you know, we have the five senses, and this second nerve will be that optic nerve head that will be like a slowly like damaged, and irreversible nerve loss will happen in the glaucoma. So there are risk factors are there. Kind of like age is one thing. Above 40 years, most people are prone for the glaucomas, and as well as whoever is having the diabetes, hypertension, family history of glaucoma, thyroid issues, and myopia, as well as like whoever is on like autoimmune disorders, which most of them will be using the steroids, oral steroids or systemic steroid medications, as well as whoever is like asthma, they'll be using the puffs or inhalers. So they are like more prone for the glaucoma. These are the risk factors for the glaucoma.
So if I'm diagnosed with glaucoma, what are my treatment options, and will I need surgery immediately,
Okay.
or are there any alternatives? Also, does the treatment differ from the type or the stage at which glaucoma occurs?
Yeah, and it's a good question, and a lot of people are having the doubts. This is from their perspective. See, once it is like you are diagnosed with glaucoma, it is like there are like multiple options are there, you know. One is a medical treatment. Commonly, it is like a glaucoma. It won't be like we'll be like doing thoroughly investigations we do, and we check the pressure, we check their nerve status, we check their field, visual fields we call it as all these things, and their corneal thickness and everything we check and we detect and we confirm the glaucoma and type of the glaucoma. Based on the type of the glaucoma, we do give medical treatment and laser treatment options are there. Surgical option is the last one. It's not the first treatment, and most commonly reserved for the advanced cases.
I've also read somewhere that there are certain simple signs like eye pain or increase in spectacle number that could be the early signs of detecting glaucoma. Can you help us understand these symptoms better?
Okay. Yeah, this is an important question you have asked, and it's a most common question, and as well as like it should be known to everyone. Awareness should be there. What are the symptoms? And the symptoms of the glaucoma is most commonly the types of, depending upon the type of the glaucoma. Open angle glaucomas are there, closed angle glaucomas are there, and open angle glaucomas are like mostly asymptomatic most of the times, and there won't be any pain, no blurred vision, nothing will be there initially till the stage advances. And yes, I agree, and some people have the like they have to change their glasses This is a very rarely it happens, not in all the cases. Pain will be there in closed angle glaucomas. All of a sudden they'll be like losing their eyesight with the sudden onset of like a severe immense headache will be there, eye pain as well as like vomiting. They'll be losing the eyesight at immediately, all of a sudden. That is an indication of like acute closed angle glaucomas. And other glaucomas, other types of normotensive glaucoma or open angle glaucomas, there won't be like many symptoms or anything till the stage advances. So regular checkups are very important.
Another question I wanted to address today, are there any other comorbidities like diabetes or hypertension that could lead to glaucoma? And are there any precautions that one can take?
This is a very important question you have asked. In fact, I appreciate it because it's nowadays it's incidence of like diabetes and hypertension is quite so much. It is in our population, entire population. Diabetes percentage of the diabetes is like more and more. So whoever is like having the high blood sugars as well as like hypertension, they should be like told by the physicians or whoever is treating the people like physicians or diabetologists or like general physicians, the doctor should recommend that eye checkup is a must because it's like not only for this glaucoma, detecting the glaucoma or any other thing, glasses checkups or something. And they should be like going for the eye checkup so that we can see whether their retina is good, whether they have any like they are developing any retinopathy or like diabetic changes inside the retina also we can see. So, main important things they have to consider is whoever is like diagnosed with diabetes and hypertension, early detection, and those people should be like taking care of their like controlling the blood sugars and blood pressures, and going for the regular eye checkups as well as their like routine their checkups.
And lastly, could you address a few myths about glaucoma?
Yeah. Yeah, the most common myths about the glaucoma is like people do think that we are young and we don't develop glaucoma, and we are like children won't develop glaucoma, and this is mainly like limiting to the age old senior citizens and all. It's a myth. Most commonly, it is like it can occur in any age group. We can see in even like less than like in their third decades also the disease can start, as well as in like the children also. There is a type of like glaucoma, congenital glaucomas are there, and there'll be like developmental glaucomas are there. So they can have this like even at the age of like newborn people also can have the glaucoma. So it's not like a certain specific age only will get affected and all. It is not a myth. It is not a truth. So you have to be like going for the regular checkups whenever you get the. To create awareness is also very important. Glaucoma, because it's nobody. Most of the people they are not aware of the glaucoma. What are the consequences they'll be having if they develop glaucoma and all. Once they come and once they are told you have a glaucoma symptoms and signs and all, we need to evaluate. They'll be like they don't take it seriously. So they have to be like thoroughly evaluated for the glaucoma, and they should be like going for the regular checkups. Once we cross 30 years of age, usually eye checkups are is a must. And if they go for eye checkups, and we can detect the disease at the earliest. And whoever is having the parents or having the glaucoma means they are at most risk people, and they are the coming under the risk segment. So these are the people they should be going for regular checkups and all, so that we can detect and treat the glaucoma, we can prevent progression.
Well, we hope this conversation has helped you understand glaucoma a little better and why regular eye checkups are so important. Remember, early detection can make all the difference in protecting your vision and your loved one's eyesight. Share this episode with your family and friends. Let's spread awareness about glaucoma. Until next time, take care of your eyes and stay healthy. For more information, follow us on @imattersdaily. Thank you.